You're watching Single Process with Joe and Bob. We created this series of videos to help you navigate the difficult world of divorce. We hope this helps you on your journey. Our episode today is on how stress affects your health. Bob, we have seen this with so many of our friends, suddenly getting really ill as they're going through the stressful time.
I'm sure viewers have seen this too. Someone's going through a horrible time and all of a sudden they get cancer or something serious and you're like, oh, that's a horrible coincidence. Well, it's not necessarily a coincidence, right?
So for me, the interesting thing was I cracked like 5 of my teeth, and I realized that I was manifesting my stress by grinding, clenching, and it was a really difficult process just to fix that, but that's minor compared to what some people go through.
I agree. So we have Dr. Sharon Karp with us, who actually prefers to just be called Sharon, but she's a really seasoned rheumatologist with Stanford Hospital in Connecticut, over 20 years of experience. And I will also add that she's a really good Zumba dancer.
Yeah, Sharon. Hi, Sharon. Welcome.
Hi.
Thanks for joining us today.
So what do you think? So how are you seeing stress in physical ways in people?
Well, we know that stress has a lot of different manifestations, and stress can affect your immune system. Your immune system is really the soldiers that protect your body. And so when you're under stress and your immune system isn't functioning correctly, your body is much more susceptible to develop infections, to develop underlying connective tissue diseases, to develop cancer that might be held in surveillance at other times when you're not under stress.
Really? So cancer is the cells are there and they may just be almost dormant until the stress sort of accelerates them, adds fuel to the fire?
I think that everybody really believes that. There are abnormal cells in everybody's body, and the question is, why does it come out at certain times and not at others? And why is it all of a sudden unleashed so that it can multiply so quickly? Your immune system helps to hold all of these things in check. Just like when you're under stress, people complain that they get shingles or you get herpes infections.
Yeah. Right.
Your body always has these viruses. They're hibernating in nerve cells, and when you're under stress and your immune system can't keep them in check, they come out.
So there's so much going on when you're under this kind of stress, right, Bob? Depression, You've got maybe anxiety.
That's what my question is. How do you know that you're sick and not just depressed?
Well, unfortunately, that can be very difficult to know because a lot of the symptoms can be the same. People complain about fatigue, they're sleeping all the time, they're anxious. Oftentimes people have panic attacks and they can get short of breath or they can get chest pain. But I think that there are certain things that you really have to monitor, and if you have these symptoms, you know that you're in trouble, and at least that you should see somebody in order to make sure that something else isn't going on.
Tell us what those are.
Yeah.
Tell us what people should be watching out for.
Well, I think that anybody who complains of weight loss that's more than 5 to 7 pounds.
That sounds like a bonus to me.
I think
take your help.
I think that when people have chest pain, if you're short of breath, if you have any kind of fainting episodes, palpitations, especially if it's an irregular heartbeat, chronic diarrhea. People oftentimes complain that they have irritable bowel syndrome, but where's that line between knowing that it's irritable bowel and that you actually now have something like Crohn's disease or ulcerative colitis? So, if you have bloody diarrhea, if you're having diarrhea more than 5 to 7 times a day, I think you really need to see somebody.
I don't see somebody regularly, though. How am I going to get in? I wish I had.
Is this a time where a baseline physical is a great idea?
Yeah.
I think that it really is. I mean, it sort of goes back to having someone who knows you, and unfortunately, most people don't. But
Right.
I think that when you're going through a stressful time like this, having a baseline physical is always a good thing, even just alerting your doctor to the fact that you are going through this so that they're able to monitor you and they know what is going on in your life.
Sharon, sometimes today when I go to the doctor, I'm not my physician, let me just say that, but and certain specialists I've seen, they're so busy putting notes on their computer and their tablet that we're not having a rapport. And that gets lost a little. Is it important to find a physician? Are there still physicians out there who will really take the time to look at your mental well-being?
Are there still physicians out there? And how much do they charge?
I mean, they're all being squeezed by, insurance.
Squeezed by all the regulations. Yeah, it's true.
Well, there are definitely still physicians out there like that. unfortunately, when you come to someone for the first time under a situation like this, it's very difficult. Your physician doesn't know you. They don't know what your baseline is. And
Or
that
family
puts
history.
you, or
Yeah.
your family history, that puts both you and the physician at a disadvantage. If you have a physician that you've had a relationship with, they really know who you are. So they know when you're in trouble. They know that this is out of proportion to what it should be. And they also know your family history. There are a lot of diseases that under stress come out. If you have a family history of certain diseases, you're more likely to see this manifest itself during stress. So those are things that physicians will look out for. It's not a good time to see a specialist for their first time because the specialist doesn't know you. So you really should go to your family doctor and then be referred to somebody.
Yeah.
To someone.
Bob, you raised something about cortisol levels. I wanted to ask you about that.
Cortisol is such a buzzword these days. Like,
Well, it's a buzzword because it happens to be the chemical that is released in your body during times of stress. And it's part of your fight and flight mechanism. So it makes your heart race. It can give you diarrhea. It gives you more energy. It makes you anxious. There are so many different things that it can do. And so these are both symptoms of anxiety, but if you also look at it a little further, a lot of these symptoms can also mean that you have an underlying disease going on.
yeah.
So the question really is, where does that line? And it's difficult for a person to know that, especially when they're under a lot of stress, because you're really not looking at it. You're so busy seeing everything else that's going on.
Do you find people neglecting their own health at these times, worrying about their kids, worrying about the finances,
Of course.
and letting this go, even if they know they have symptoms that are troubling and worrisome? Do you find that they should have come in sooner to see
Definitely.
you or be referred to you?
Definitely. First thing is that most people, when they're going through things like this, they can't even think about themselves. It's the last thing. And they don't look at the normal signs that can be warning signs. Oftentimes it's people around you who can tell you when you're really in trouble and when you really need some help. I mean, your family, your children, your best friends, they know you and they're actually looking at things a little more objectively so they can see when you look like other things are going on and that this is
When you
not
look like crap.
strictly
Sometimes you
stress.
can't see the wood from the trees when you're in the forest,
So,
right?
What do you recommend to people? I know they're the basic things, right? You want to eat a healthy diet. You want to get lots of rest. That's not always that realistic when you're going through this. But
It's
what do you
not that
suggest?
realistic, but unfortunately, it's something that you can try. You have to try to take time to do. Exercise is great. Going to Zumba is wonderful.
Yeah.
I'm Sharon, Zumba instructor.
Doing yoga, going for a massage, getting your hair done.
Does that really
something
work,
that's
going for a
just for you.
massage?
You know, I think that it depends on the individual. Some people, it's a little bit too much quiet time and they're thinking too much about what's going on as well. But other people, it's really pampering that you need.
Okay.
I mean, you have to feel your own worth and that, you know, you're entitled to this.
Yeah.
So a lot of times, unfortunately, I think that people probably don't do this also because they're worried about finances.
Yes.
And so there's so much that goes into all of these things. So it's very easy to say that these are the things that you should do. So you have to find what's right for you.
Okay. So probably the
Take
most
a bubble
important
bath.
takeaway we can be the takeaway is get a physical. Get a physical and start paying attention to some things that may not just be depression and stress.
Exactly.
And if there is something going on, go see a doctor.
Yeah, go see a doctor.
And go get referred to the right specialist. Sharon, thank you so much for joining us today.
Yeah.
Thank
For
you.
information on this
Advice.
segment and more, log on to singleprocess.me.